So, okay, so today I'm talking to Mark Reed, who is a coach and has worked as a social prescriber in Newcastle. And we're going to have a chat about what social prescribing is and how it might be able to help people. So, hi, Mark, and thanks for agreeing to do this.
Hi, Jackie, you're welcome.
So, first question, answer as simply or as complicatedly as you like. I've just made that word up. What is social prescribing?
So social prescribing is a way of supporting people with health and well-being, with their own health and well-being. And it's a non-medical conversation or a non-medical intervention. So lots of doctors' practices now have social prescribing teams in. And basically, we're not prescribing medicines. We're prescribing or we're identifying opportunities for people to find other ways to manage their health other than, it's not instead of taking a tablet or instead of medications, it could be alongside medications, but it's a way of helping people access support to manage their own health and well-being.
So if someone goes along to their GP, is it something that their GP could say, oh, I think you would benefit from social prescribing? Is that how it works?
Yeah, that's a common route, is the GP might mention it. It could also, you could be referred from a pharmacist. So if you were talking to a pharmacist about medications, or a community group, or a mental health support group, or anybody, a nurse, if you're having a checkup with a nurse. So anybody that you might have an interaction with through the health system could refer you. Equally, you could request to see a social prescribing person. So if you were talking to a GP or a receptionist at a GP practice or a pharmacist, you could just ask and say, do you know if there's a social prescribing offer attached to this practice or within the area? So you could self-refer or be referred.
So why would somebody be offered social prescribing or want to take up social prescribing rather than going down a different route?
So imagine that I've gone along to my GP and I've been going for say 6 months and having different tests, and the GP says, okay, Mark, you've got one of these conditions. They might say you've got, I don't know, diabetes or epilepsy or a heart condition or a lung condition like COPD or emphysema or asthma. So if something was new to me, if a difficulty was new to me, I might want to talk that through with somebody. I mean, I could talk it through with friends and family, but I might want to talk it through with somebody privately, one-to-one, and I might have all sorts of concerns about that. And a person who's working in a social prescribing team could support me to access different resources. So they might be able to help me around diet, that they could introduce me to somebody who could help me with diet. So the prescriber will not necessarily say, these are good foods for you to eat with diabetes, but they may be able to link me up with somebody. A lot of social prescribers these days are called link workers. So there's maybe a bit more of a clue in that name, that they're linking people up with other people who can help. So it could be that I've got a new condition, or it could just be that I've said to the doctor, look, I've had this bad back for years and I'm not getting anywhere with it. I don't want to keep taking the painkillers, but I'm a bit nervous about exercising. Can you help? And the GP might say, she might say, no, but I do know somebody in our team who can, and pass me on to a social prescriber or a link worker.
Okay. And if that happens to somebody and they got an appointment to see a link worker, what kind of things would they expect from that first meeting? How in depth will the link worker go with them about their condition?
Different teams. There are lots of different link worker teams, social prescribing teams, and they each have their own criteria or their own plan or their own contract to fill. Some social prescribers will work with anybody over the age of 18 to however old they are, and they'll work one-to-one and they'll work face-to-face. At the moment, because of the COVID things going on, most social prescribers are working over the phone, either video calls or phone calls. But it's up to the person, really. The principle is that it's a kind of coaching offer. So the person who's sitting there, so if I'm the person who's sitting there, we call them people rather than patients because we're not medical. So the person that's sitting there, given the opportunity to think through what their options are, often knows the answer. They know what they need, but they don't always know how to access it or have the confidence to ask for it. So it's entirely up to the person. It can be a fairly lightweight conversation about, hey, well, I could do with going to the gym, da-di-da-di-da, here's some information about gyms, and that's me done. Or it could be deep if it's because if I've got a problem to do with long-term stress because of family issues, that might take a more investigation.
So how is this, is this being used a lot? Is it sort of being used throughout the NHS or on a local level, or how does it work?
It's been used increasingly more and more. So it kind of came about, it was first talked about probably 10, 15 years ago. When I say talked about, I mean, amongst researchers. Research was done into this 20, 30 years ago. And what the research came up with was that people need more than just medication sometimes. That a lot of people, when they looked at people who manage their health well sounds like a judgment, who manage their health effectively, what they often find is that those people had support that wasn't necessarily medical support. It wasn't necessarily through a doctor. So they might have had a friend who could introduce them to a group, or they might have known somebody, or they might have had the confidence and the money to go privately and get some help, you know, because a lot of people might struggle with that. So social prescribing grew out of a lot of research that said a large part of being well is not about what the doctor says to you. It's about how confident you feel in your ability to manage your own condition. So if I'm diagnosed with epilepsy, the GP might be able to give me some medications. But if I've got people around me that support me, friends, family, groups, information, access to self-study, etc., then I'm much more likely to be able to manage that epilepsy so that it's less of a difficulty in my life. So it is now available across the NHS. It's possibly not everywhere. The answer to that question is, I don't know that every GP practice has social prescribing in, but a lot of the GP practices are managed by primary care networks, which is a group of GPs that share information. And a lot of the primary care networks are taking on social prescribing teams. And there are a lot of other organisations getting involved in delivering it as well. So 5 years ago, there were very few. There was maybe one or two or three teams in Newcastle providing it in maybe 10 to 20 practices, GP practices. Today in Newcastle, I would say a lot of GP practices have social prescribing teams. Okay.
And from how you describe it, it sounds like it's very empowering for the individual. So it sort of, you know, puts the health back in their hands so they can find ways to help themselves almost. What kind of results do you see? What kind of research has been done into the effects that it has on people?
Okay, so I worked with a team recently that was part of a pilot, a 5-year pilot that will possibly continue on. It's coming to the end of the 5 years for that team, for that pilot rather, but that will possibly carry on. And they showed that it reduced the number of times that people went to visit their GP practice. That was one of the main key points that came out of it. The pilot program measured people's progress by taking what we called STAR results. So we would ask people, how do you feel on a scale about your lifestyle, about your friends and family, about where you live, about your money situation, about your positivity, about your ability to manage symptoms. So there were measurements taken of people, you know, orally, face to face. We took measurements and asked people their opinions. And as they went through the process over the 5 years, not everybody was there for 5 years, if you know what I mean. It was up to people how long they spent with the program. But the evidence was that a lot of people's self-assessments increased in various areas, particularly things like lifestyle and positivity and things like that. And also, in terms of the raw data, it saved the NHS a lot of money because people were going to the GP or going to hospital less often because they were more able to manage their own condition.
That's really interesting, and the way you've described it there, it sounds like it's going to grow. It's going to become available to more people in various different circumstances and for different health conditions as well. because I personally am aware of social prescribing for mental health, but obviously you can use it for a range of physical conditions as well. Is that right?
Yeah, and like I say, different groups have different criteria and different focuses. And there's talk about, I've heard talk about working with people with specific problems, specific issues. I've also heard that, I know there's a new pilot up looking at social prescribing for young people, so people younger than 18. So it's quite new, but it feels to me like it's quite rapid, the increase in the spread of social prescribing. I think because the research goes back, it probably goes back 30, 40 years. It grew out of other things where there was some research going on in the 1960s and 70s around how come some people in some areas of the country live to be, their life expectancy is 80 or above. And in other areas of the country, their life expectancy is 60 or below. You know, and what they looked at was, it was around, a lot of the evidence that came out was not necessarily about anything the individuals did. It was around having control and having choices, your own choices, your own sort of autonomy to be able to make choices, and how included you felt. So when you were saying about allowing the person to have, that it's in their hands, it's a kind of coaching model which starts with the idea that I believe you can find the resources to help yourself gain whatever it is you're looking to gain. And I also believe that it's helpful for you to have somebody who you trust, who's objective, who'll give you feedback and support. But they're not a friend, they're not family, they're not invested in your outcome, it's your outcome, it's not their outcome. So it goes back a long way, the research. So I suppose, and this is a guess on my behalf, but I have read around it over the last 20 years. I've seen this happen over the last 20, 30 years, that there's a direction of travel where there's been a lot of research done about how people manage themselves well. And now it's been spread out in the corporate sector, in the business sector, it's been spread out in private sector, in private kind of therapy sector. And now it's starting to come through in the health sector and in the national health sector. So yes, it is quite a rapid increase in uptake. And also it's changing as it goes, as it's learning. So it's a kind of learn as we go process at the moment.
That's brilliant. I think you've given us a really good overview of what social prescribing is. And I think finally what I would say to you is, if somebody is interested, or somebody goes along to a pharmacist or a GP and they're told that social prescribing might help them, and they're a bit sort of, I'm not sure about that. Have you got any sort of one thing that you could say to them about how it might benefit them, or just give it a go?
So I understand people's hesitancy in trying something that they've never tried before. I share that. If somebody says to me, do you want to go and try this thing, Mark? I go, oh, does it cost money? Is it difficult? Am I going to have to take my clothes off? Am I going to look stupid? Are they going to ask me daft questions I don't know the answers to? You know, so all those are just my personal anxieties. And so I think there's something about if you feel you struggle with something, especially if it's something you've struggled with for a little while, or it's new to you and you're not sure about it, you're welcome to go along and speak to somebody privately, one-to-one. They're trained to support you. It's your time, it's your session. There are no big rules. You can stand up and walk out anytime you like, or if it's a phone consultation, you can say, thanks very much, it's not for me, and put the phone down. It's entirely up to you whether you take part in it or not. Nobody's going to tell you off if you say, I don't want it, or I don't like it, or it doesn't suit me. You could say, it might suit me, I'll take some time to think it through. So there's no pressure on. You don't sign a contract and say, yes, I'll come along every week or once a month, or once every 3 months, or whatever the pattern is. So nobody's going to hold you to that. It's entirely up to you. And if you don't like it and it's not useful, then that's fine. So what I would say is, I understand the anxiety and the difficulty around starting something new and talking to somebody about something that may be very intimate and meaningful to you. And I also know from experience that lots of people say, lots of feedback is, oh, I didn't think that was going to be any good, but it's made a real difference to me. So what I would say, the one thing I would say, it's a long roundabout way to get to the one thing, sorry, Jackie, but the one thing I would say is, if you want to stay where you are and manage that pain or that difficulty or that discomfort by yourself, then I absolutely understand that. If you really feel it's time to do something different to try and manage that situation in a more effective way, then give social prescribing a try.
That's brilliant. Thanks very much. Like I said, you've given us a really good overview, and I hope that we can help people, give them some information and put some of their fears or concerns to rest. So thanks very much, Mark.
Thanks for the opportunity, Jackie.